You're watching Nevada Business Chronicles. Take a journey with us to see the innovative businesses that put Nevada on the business map. Connecting you with the businesses, events, and organizations that bring innovation and prosperity to the Nevada area, please welcome your host, Mitch Burney. If you have chronic pain, you want to sit down and pay attention to this episode. We're here at Nevada Advanced Pain Specialists with Dr. Narizi and Dr. Patterson. Thank you so much for having us here today.
Yeah, thank you for making it.
Thanks for being here.
This facility has made an impact on so many lives in our community. I cannot wait to show people what goes on here.
Come with us, we'll give you a tour.
Let's go. Tell me a little bit about Nevada Advanced Pain Specialists, what you do here, and what inspired you to open the facility.
So I moved to the Reno, Tahoe area back in 2007, and at that time I realized that there was a lot of patients here with chronic pain. Statistically, if you look at it, 100 million Americans suffer from chronic pain on a daily basis. At that time I saw that this community had a lot of those patients, and I decided to create a comprehensive pain clinic to help address their needs and hopefully give them their lives back. Dr. Narizi joined the practice in 2014 because I knew I needed good help to allow our clinic to see more patients.
That was a great fit for me. We do have a different background in what we do. We did our fellowship in interventional pain management, both of us, with two different backgrounds to make sure that we can offer the best technology and treatment to our community.
We've combined our specialties. We are ultimately trying to use the biopsychosocial model to treat every single patient that comes through our doors. And what that means is that we try to, address any physical problems they may have, any psychological problems they may have, and on top of that, use interventions to treat their underlying pain issue and hopefully make them a better person and whole.
Providing the best care, plus also educating them. So we are very much involved in R&D and education.
When we see patients here, we initially want to start out with the simplest solution to treat their pain. And that would involve active treatments such as physical therapy, behavioral health, and massage therapy. Our goal is to comprehensively treat their pain using those modalities in hopes that we can solve their issues the easiest way possible.
Something that people need to understand about your center is that you are pro non-opiate pain treatment options first.
That's right, yeah, that's right. When we talk about conservative treatments and minimally invasive treatments, we have different modalities. Hands-on manipulation technique, using the TENS unit for the patient, or conditioning for muscle. And also we are in process of adding virtual training.
As a physical medicine rehab doctor, when I interview the patients at the initial consultation, I can't tell you how many times I heard that the patient has tried and failed physical therapy in the past. But when I really delve into it, they had the wrong type of physical therapy. And so that's why we like to work with a therapist who actually puts their hands on the patients, does a lot of, manipulation, strain, counter strain techniques, myofascial release, not just therapeutic exercise. We're not trainers, if you want to go get training and you got to go to the gym and work with a personal trainer, they'll tell you what exercises you need to do. But here you actually need the hands-on care in order to feel better, to do exercises to get that conditioning and training in beforehand.
And some of our patients, they want to be conditioned to what they used to do for work-wise. They had an injury, for example. So I want to make sure that what type of job they do have, and we can get there. If the job requires them to walk half a mile, we have that ability to get them after the right therapy, just to make sure that they're able to do what they're asked for in their daily job.
Overall, we try to individualize the treatment. Not every form of physical therapy is going to benefit each individual patient. So you need to find the right modality, the right therapy at the right time to treat that person. We realize that over the last decade, opioids in the United States have led to an epidemic. Plus, they're not really treating the actual problem. They're just masking the patient's pain issues. And so here, we try to look at doing other treatments that actually can treat the problem, not cover it up. And that's why we use these other minimally invasive treatments to address patients before we consider putting them on opiates.
That's true, and also our state of Nevada has the 4th highest rate of death from opioid overdose. So our neighborhood has been hit so badly by opioid crisis. And this is our commitment to our community to make sure we do have safe alternatives for opioid to treat them.
Yes. Unfortunately, all patients aren't going to get better with conservative care. And that's why Dr. Narizi and I did interventional pain fellowships so that we can offer patients procedures to alleviate their pain. The first step of doing that is getting a thorough physical examination and then having some imaging of that area to see if there's abnormalities that correlate with what we're hearing and seeing. The next step at that point then would to diagnostically block those structures that we see and see if the patient's pain goes away.
In order to do the diagnostic or therapeutic treatment that we do, we use the image guidance for every patient we have in practice. That can include X-ray, it can include the ultrasound, and in some situations we use the nerve stimulator because we want to make sure that when we do the treatment, we do it right and we find and identify the structure that we are targeting. And also helps us to avoid from structures that we don't want. We don't want to hit that nerve. We need to stay away from the artery, vein, and that image guidance helps us to get there and provide the best safe treatment.
Once we have an idea diagnostically what's going on with the patient, then we'll bring them into this room. This room is our fluoroscopic guided procedure room. And we'll set them up with interventions to try to treat their pain. And this can be as simple as a facet joint cortisone injection, a epidural steroid injection. It could be a shoulder, hip, or knee injection. Or if we do those procedures and the patient doesn't get better, then we can look at doing simple surgical implants to help the patient. A couple of the things we have here are pain pumps and spinal cord stimulators. Pain pumps help more global pain. It can be used to help spasticity, chronic non-malignant pain, or even patients dying of cancer to help give them pain relief for the remaining time that they have. Spinal cord stimulators are better for regional pain, kind of helping patients, if they have neck or arm pain or back and leg pain, we can use those to help out. It's also important to know that pumps typically help mechanical or neuropathic pain, but stimulators really only help with neuropathic pain.
The beauty of what we do is typically we have a chance to test them and diagnose them by doing some type of procedures beforehand. Many of the patients, they've had back surgeries before in the past, but never had a chance to try out a surgery before having a surgery, and hopefully they benefit from it. With what we do, we're able in majority of our procedures to test that beforehand to identify the right patient. And that makes us different from other type of procedures that can be offered out there. For example, the pain pump. The patient can come and have a single shot injection of the medication that we think it's right for the patient, and we document the patient response from. We do physical therapy maybe after. We use it in patients who do have cerebral palsy, the spasticity, or they have stroke-induced spasticity. We may use baclofen. So we do physical therapy beforehand and afterhand and see how much of relaxation, improvement in their functionality of their muscles we get. And then if they're a good candidate, we proceed. Spinal cord stimulator, we do the same thing. We place them temporarily and everything stays outside. They go home, they live their normal life, and they get a chance to test it for 7 to 10 days. If that helps them, that's when we offer them the permanent. So we are confident they can benefit from the device because they had a chance to test it beforehand.
It's important for patients to know that a trial where they get to try these out, it only takes us a couple minutes to do a pump trial. A spinal cord stimulator trial only takes 10 or 15 minutes. And there it's done with local anesthesia, patients awake, talking to us, laughing, joking. It's really not painful at all. And just like Dr. Narizi said, they know the benefit. And if it helps them, then we can actually then set them up for a surgical procedure that takes us 30 minutes or an hour at most to have these implanted underneath the skin to give them pain relief for the rest of their lives.
Our goal in this practice is to offer non-opioid alternatives for the patient to benefit from. But we have situations that a few patients may exhaust all options, and then opioid becomes the only option for them. But we take that very seriously. Come with us, I'll show you how we treat those patients.
We took the time and made the investment to make sure that we do urine drug screening and have the best technology available to assess our patients for several reasons. One, make sure our patients being compliant, they're taking their medications as prescribed. Two, make sure our patients aren't diverting their medications, i.e. meaning they're selling them to the black market within our community. And three, making sure our patients don't have a substance abuse or misuse problem, meaning that the medications we're prescribing, they are misusing them or taking illegal drugs at the same time.
We want to make sure that our patient is safe. Plus we have some patients that they're not here to get better. They're here just to abuse the system. They are here to take advantage of what we can do for the patient to help them. This is one of the tools that we use to identify those patients, along with the psychological testing that we do to make sure that our patients are safe and do get the best treatment.
As a person living in this community, I want to make sure that I provide a care that I can be proud of and not worry that I'm contributing to the problem.
Pain psychology is a big component of our treatment because some patients, they don't have the insight of the anxiety and depression presenting itself with pain, or their pain is a result of their anxiety and depression.
At the initial appointment, we do two things. One would be we give patients an online psychological assessment. That psychological assessment also includes the opioid risk tool. The opioid risk tool will tell us if a patient is mild, moderate, or high risk for using opiates on the front end. The other thing that we do is we get a random drug screen. We're able to find those results to see exactly what the patient has in their system. That tells us if the patient is compliant with medications that have been taken from somebody prior to seeing us, or if they're using illegal drugs that would preclude them from being a good opioid candidate. The top two reasons why patients come to see us are for spinal pain and chronic migraines. I'd like to touch on chronic migraines for a second because we have found that Botox can significantly help patients, and we've been doing it for 5 or 6 years.
How does Botox help migraines?
Funny that you ask. A lot of people wonder the same thing because they've always known about it being for cosmetic reasons. For chronic migraine, it does two things. One, it stops the nerves around the head and neck area from releasing neurotransmitters that can potentiate a migraine attack. And two, it relaxes the muscles in that area. Because think what happens when you do have pain, you tighten up, and so the muscles in that area, if they're relaxed, can no longer do that. We have found that by relaxing the muscles around the head and neck area, we can either prevent the onset of a migraine, or two, if they do have a migraine, it'll make it not last as long for the patient.
That's proven by studies. So we know that those patients, those muscles they have in the shoulder, around the neck, the frontal area, they all trigger for migraine. So if you relax those muscles, right back of the shoulder, get the forehead, the side, they can benefit from that relief to have less of migraine attacks.
Procedure is simple as well. It only takes about 10-15 minute office visit, and it's done every 3 months. Patients completely benefit.
Sounds like they can get a little other cosmetic benefit out of it as well at the same time. I'm sure that's a little bonus.
I always joke with my patients that the next time I see them, they'll look younger as well.
I joke with them that the side effect is you can't frown anymore. So they laugh. But the main goal is to treat the pain.
What other treatment options do you offer here?
One of the treatment options that we do here is varicose vein ablation. We have so many patients that come to our practice, complain of restless leg syndrome, they complain of soreness in their legs, being fatigued in their legs, and we do multiple studies. It's just not coming from the back, it's not the nerve damage. Then we realize that this is because they have diseased veins, the varicose vein. So those veins are not diverting the blood back to the heart, so it stays right there. That can cause pain for them. So one of the treatments that we do is to get rid of those bad veins, those diseased veins, to use the radio frequency and to cauterize them, then we divert the blood into healthy veins.
And back to the heart.
Back to the heart, that's true. Beforehand, we also have a certified vascular tech who does the ultrasound for us and to identify the patients who have suffered from varicose vein.
Treating spinal pain is very complex. As you can see, there's a lot of structures that go into making up a spine. As we get older, our bones get thinner. When our bones get thinner, it can lead to a condition called osteoporosis. A consequence of osteoporosis is you can develop a spinal fracture. One of the treatments that we do here at Nevada Advanced Pain Specialists is that we can put cement in those fractures to make the patient's pain go away.
Wow.
It is a great treatment for the patients because it's one of the treatments that when we get it done, patients get relief right away. This is the one that typically when they come out of the procedure room, the pain is gone or almost very minimal. That's one of the ways we know if the treatment also was effective for them or not.
That's amazing.
Yeah. To see somebody come in anguish and walk out pain-free is an amazing experience as a physician to see.
Even we have it with cancer patients who do have lesions in their bone, and those lesions are cancer lesions and they cause pain. We can literally go into that structure of the bone and burn those lesions and fill that with cement. That's just one of the other treatment options we do have when it comes to kyphoplasty.
How does cognitive behavioral therapy get mixed in with pain management?
So far what we know about pain, we know that pain has two components. One, the emotional part, and one is the physical part. So the emotional part can present itself with depression, anxiety. So the patients who are in pain, they can become depressed and anxious over time. It's important for us to identify these patients and to intervene very soon to make sure that their physical pain is addressed as well as their emotional part of their pain is addressed. But also, we do have some patients who have depression and anxiety, but they manifest themselves with pain. They come and they, complain of pain. But indeed, the problem is because they are depressed or anxious. We do have tools here, in pain psychology. We have counselors on board to tackle and address every one of these issues.
So somebody that's been in a car accident, for an example, got seriously hurt, has real pain, but at some point in time the pain goes away, but the brain doesn't realize that there's no pain left and they still feel pain.
There are multiple patients that can be involved in a car accident and heal, but that accident becomes part of their identity, especially the pain portion. These patients, if the pain goes away, they have no further identity. Subconsciously, the patient doesn't even realize that they're doing this. So we can't physically treat the pain. We have to treat it from a psychological standpoint to get that emotional distress or suffering to resolve before the patient will feel better.
And you certainly don't want to do procedures on somebody that doesn't need one.
Absolutely correct. Because we know they're not going to get better. They're not going to improve.
Problem is somewhere else, so it's coming from their emotional anxiety that they have to depression. It's interesting to know they don't have insight which one is the problem. As long as there's a train on that rail track, that's all brain cares about. So that train can carry depression or it can carry pain. The outcome can be the same and brain does not have the insight. So that's why we introduced that pain psychology into it, to identify and bring that insight back to the patient.
Really important and something I wouldn't have considered. Probably not all that common, but you still have to look for it.
Correct, and that's why part of our initial assessments, we screen every patient to see if there's any underlying psychological factors that may be contributing to the patient's pain.
That's true.
Steve, I understand that you're a patient at Nevada Advanced Pain Specialist. Tell me a little bit about how you got here. What happened?
For about 15 years, I have been bouncing around from pain specialist to pain specialist with absolutely very minimal results.
You had gone through some surgeries, as a matter of fact, prior to coming here.
Approximately 5 spinal fusions.
And even after those, you were still in pain and taking a lot of medications for that.
Tremendous amount of pain. Bilaterally throughout my hips, down my legs, up into my spine. I couldn't walk I couldn't walk out to even get the mail. I couldn't go grocery shopping, so yes, I was.
Before you got here, you were taking about how many pain pills a month?
Between 300 and 350 opioid tablets a month.
And then when you met Dr. Narizi, what happened?
He changed my life. It opened up a whole new world for me. He implanted a intrathecal drug implant into me, which reduced all of my opioid pain medications to where I'm only down to 2 a day now.
Unbelievable. And then you also had a stimulator implanted.
Yes, he also, in February of 2014, implanted a St. Jude's neural stimulator, which works wonderful.
What things can you do now that you weren't able to do in the past?
Sleep.
Well, that's a big one.
I can go grocery shopping with my wife so she doesn't have to carry that load all by herself no more. I can ride a bicycle. I can get out and go to the park. I can play with my kids. I can do just about anything that a normal, uninjured person can now.
It probably goes without saying you'd recommend other people that are trying to manage their pain now or that are finding themselves in need of pain management to come to Nevada Advanced Pain Specialist.
Before I came to Dr. Narizi, I had given up on life. And anybody who has that type of pain, constant chronic pain, and is looking for a new way out, I had strongly advised to come talk to Dr. Narizi or Dr. Patterson at Nevada Advanced Pain Specialists.
So happy you're able to do the things that you weren't able to do before, and thank you for taking the time to share that with us.
Thank you.
Jeff, what caused you to seek out Dr. Patterson at Nevada Advanced Pain Specialist?
Well, I'd been suffering from low back pain with radiation issues down my legs. Received a mailer from the clinic about a spinal cord stimulator, which was news to me. Went to the seminar on that and thought, okay, let's proceed. Had an initial consultation. In addition to the spinal cord stimulation, another option presented was what's called ablation therapy.
And you wound up trying both. First, the spinal cord stimulator, which had some success.
Correct.
But then you went on to the ablation therapy, and how did that work?
The ablation was great. In and out, not much problem as far as being under the knife, if you will. Simple procedure. And I've been able to sleep much better. Don't wake up 2 or 3, 4 times a night trying to turn over without screaming. And then made it through ski season up at Mount Rose, as well as now starting to get out on the golf course.
Well, that's fantastic, being able to enjoy life.
That's been great.
Diana, I understand that you were in a lot of pain when you came here and taking a lot of medication for that pain.
Correct.
When you first came in, you had to have people help you come in here.
Yes. I have been with a cane or a walker or a wheelchair for many years. And the day that I first saw Dr. Narizi was, I was actually using my walker so I could get from one room, to another. And he was so concerned. He had people around me because I was just so wobbly, and he was so afraid I was going to fall over.
And they examined you.
Correct.
And found that you might be eligible for other treatment.
He offered me a spinal stimulator, and then he explained to me what it was and that we could put a temporary one in to see if it actually worked. So I thought about it, and we decided we were going to go ahead to see if it worked. And so it was a procedure done in his office. I went home, and the very next day I wanted to make sure that this was going to work. So I actually stopped 60 milligrams of morphine to see how much pain I was going to be in with the spinals. And I wasn't in any pain for the first time. And so the next time I saw Dr. Narizi, we decided we were going to go ahead and go. I'd be a good candidate for this system. And so I guess less than a month later, I was actually in, and we put the stimulator in. And it has been phenomenal. First time in 40 years that I am pain-free a very large point of the day now.
Wow. What about the pain medications? Are you still taking any?
Well, I was taking over 180 milligrams of morphine a day, and that still kept me in a pain of about 7 or 8 every day because I just didn't want to continue adding on and on. And so I've actually gotten down today where I can take anywhere from 30 to 45 milligrams a day, and I am pain-free a good part of the day.
So no 8s anymore, really pain-free with a much smaller amount of medication.
Yes, absolutely.
What types of things you're able to do now that you
Well,
were
I wasn't
restricted?
able to clean or cook like any normal woman could. And so I noticed that I was able to start doing things around my home, and I was able to start walking with no aid whatsoever. And now I'm in my 60s and I'm riding a bicycle again. And that so that I can try to strengthen the core so that I can do even more. After 40 years of lack of core use, you've really got to strengthen your core again. So
Sounds like you got your life back.
phenomenal. No, I got a life. There's a huge difference. I didn't have a life before. I was in bed 22 to 24 hours a day. I couldn't go anywhere. I couldn't go shopping. I couldn't, I just couldn't do anything. And we've tried things for many, many years, just with bad results. And this is the first time I've actually had results that work.
Fantastic. I'm sure people watching right now are asking how they can get a hold of you.
They can find us at 5578 Longley Lane. Our phone number is 775-284-8650, or they can find us on the web at NVAdvancedPain.com. I'd encourage all of them to go to our website to learn more about us, see the procedures that we do, and follow us on social media.
Thank you so much again for joining us and having us here.
Thanks
Yes,
for
absolutely.
being here. It was a great day for us.
Thank you.
Thank you.
Thanks.
Information on this guest or to see this show in its entirety, visit NVBusinessChronicles.com. While you're there, you can watch all of our past shows on the Chronicles page and stay connected with us by following us on our social media. For information on becoming a guest on our show, contact us at info@NVBusinessChronicles.com. We hope you enjoyed the show. Thanks for watching. Tune in next week at the same time for more from Nevada Business Chronicles.